Assalamualaikum warahmatullahi wabarakatuh. My name is Rizka Dhea Amelia. I'm from Prodi Sociology. I want to tell about coronavirus in Indonesia. When the coronavirus appeared in the Indonesia, the situation immediately changed drastically. Compared to the situation before the coronavirus, there are so many impacts that occur, namely the impact on the economic sector, education, tourism, and also health. This pandemic has an impact on the economic sector, namely where many people have lost their jobs due to the pandemic and have resulted in many companies being closed due to reduced consumer, so that the company is forced to close and cannot pay its employees. In addition, many employees' salaries were cut due to lack of the income in the company. Indonesia is famous for its various tourist attractions, one of which is on the island of Bali. The island of Bali is famous for its cultural tourist object. The tourist sector is a source of income for the island of Bali because many foreign tourists come to Bali for vacation. However, due to the current pandemic condition, many destinations on the island of Bali have been closed to break the chain of the coronavirus. The tourist sector has declined, which is also affected by several sectors, namely the transportation industry, warehousing, and provision of food and drink accommodation. When the tourist sector and the island of Bali decline, the Indonesian state is certainly affected, namely the country's foreign exchange. One of its income is from the tourist sector, but because the tourist sector on the island of Bali decrease, it will result in foreign exchange for the country also decrease because there was no income from the tourist sector. Access to social service is also increasingly difficult during this pandemic, making it difficult for people to get quality food for good nutrition, because during this pandemic, apart from taking care of our health, we also have to maintain our diet so as not to cause our immune system to decline. Because if we are sick, it will be difficult to get service at the hospital, because the service at the hospital is very minimal due to the many people affected by the coronavirus, which result in many hospitals being full. Humans live side by side with the coronavirus. For that we need a new normal. Namely, new normal is a change in behavior to continue to carry out normal activities by adding health protocol to prevent transmission of COVID-19. In simple terms, this new normal only continues the habits that have been carried out during the implementation of regional quarantine or large-scale social or PSBB. With the enactment of the new normal, we are starting to carry out activities outside the home while still complying with the health protocol that have been regulated by the government, namely wearing masks when leaving the house, frequently washing hands with soap, and maintaining distance and avoiding crowds of people to prevent transmission of the coronavirus. Since the outbreak of COVID-19, in order to avoid transmission, mass activities have been carried out online. such as meeting activities that have been held together in a room. Now using the Zoom application as well as teaching and learning activities with the implementation of the new normal, like it or not, students will return to school, of course, with health and safety protocol that guarantee them from transmitting the virus. Thank you.